dentistry. Come with me.
Welcome back to the Pump YouTube channel. Today our team had the incredible opportunity to spend the day with Dr. Bhatia, a general dentist of the Orleans area. From routine fillings to emergency broken tooth treatments, join us for a behind-the-scenes look at a day in the life of a dentist. Brought to you by Pump.
The consult room, this is where I would talk to patients in more detail. We can talk about finances, we can talk about the treatment, or if they have anything to talk to me about. We have hygiene rooms. This is where you get your teeth cleaned, and we also work on orthodontics. Third hygiene room, this is a little bit bigger. And this is where I would do your checkups, where I would find any treatment that you may need, any problems you may be having, and you can discuss with me. And from there, they would come to the doctor's room, where I would actually do the treatment. For instance, root canals, crown and bridge, dentures, fillings. And we had another hygiene room where we would clean teeth, and a second doctor's room. And I usually work out of 2 rooms. This is where our sterilizing happens. We process them, we bag them, we sterilize them. And these are all the any clean instruments you need before we put them back into the appropriate room. So we have a second floor. And I give my staff a huge kitchen because they deserve it. Come this way, this is my private office. You can tell, charts, lots to do, and I actually have a private bathroom, just a bonus. Okay, right this way is where we keep our charts. So we are going paperless in like 2-3 months. So all of this is going to be gone. Okay, so we have a gentleman coming in. He has a crown on a tooth, but there is a cavity growing underneath. We have to take off the crown, assess the tooth, take out the decay. I know it's in the nerve, so we have to start the root canal therapy. After that, I'm just going to replace the top with a filling and a temporary crown. And we will see him in another appointment to give him his permanent crown. You don't like that talking. Perfect. Good job. I clean this area up and I fill it. Okay, normally, because there was a crown on it, it's like not a shape of a normal tooth, right? So I'm gonna fill it up and put a temporary crown. I'm gonna make a temporary crown. This is like a rough, this is the old-fashioned way, but I didn't have a free model. Open this. All right, so now we're gonna remove that decay. All right, you okay? Right down here, right? Okay, so we finished the treatment. I think it went well. We removed the crown. I removed the decay, and what you see here is the pre-op, and you can see the white line. That's that rubber filling that I showed you. It's gone to the end, which is what I want. I like that little squirt that I know it's sealed. And it's not in here, but we cleaned this off and I put a little filling in, followed by a temporary crown. We're gonna wait for the healing and hopefully he'll be back in a couple of months. "42-year-old male, tooth is broken. He only has like the outer wall. So now he can take it out, or my job is to fix it. So let's hope we can fix it and save it. Put bond. Okay, so we're going to put the pin in. I'm going to find a spot. Make sure it's well away from the nerve, right? Okay, pin number 2. along the axis. The end result, suction, is a brand new tooth. That treatment worked well, in my opinion. So you can see there was a large chunk of tooth missing. We did cover it with the base. We covered the nerve with the base to make sure the nerve is shielded, and we placed 2 pins to hold the large filling.
See, the one that it's really kind of tricky to get. Let's do the back one here. So this is here. Open, sweetie.
How cool is that, right? I mean, just, right? And it's simple.
Okay.
So it'll go away, and then okay. So next one, we have a male. Apparently some white spots on the tongue, and he takes them out. So let's go see what it is. Not too bad. Does it hurt?
Yeah.
Like burning? Could be like start of ulceration or some viral. Have you been feeling ill?
Well, a bit, yeah.
Yeah, like malaise or a little bit, you know? So it could be viral. Have to just treat the symptoms. So if there's any pain, you could take some Tylenol. Okay. Rinse it with warm salt water is really good for anything in the mouth. And do try brushing it, I want to see. But the side that it's on top is the least dangerous.
It also lingered for a while, that's why, like I've had it before.
Yeah.
This is like a day, I was like, whatever, but it stuck for like 2 weeks. It's like, okay, I should call.
Okay, so I'm gonna go over this.
If I was eating, or drinking something hot or cold,
Okay.
and if I breathe in, like, I can kind of feel it a little bit back there. It doesn't hurt to touch. I don't see any like inflammation or anything like that.
Probably a
It's
root. That's the divider, right? So we're gonna move over. Okay. So next one is a lady who's had cancer in the past. She had to have half of her tongue removed, and it also resulted in low saliva flow. So her mouth is relatively dry, which means constantly Vaseline on the lips. So it's a little bit of patient management. So it's a basic filling, but it's complicated because of patient management. Is that down for me? Yeah, I think it just helps. Girl. The cavity is right here, okay? It's a little deep, but we're gonna venture in there, and this is what we have to take out and replace the filling. So it's on this side, right? So I'm gonna drop down. Close your lips. You good? I don't know if you can see in my mirror, but it's sealed, right? It should go on the edge of the tooth so there's no liquid leaking. And I'm going to push it toward the tooth beside it to get a nice contact. We're actually close. So it's good. Well, that went really well. The patient was great. There's no complications. She was open enough, and it was a perfect day.